After this very short break, we are ready to start the next session, entitled Transforming Healthcare for the Future, Building a High-Performing Health System for a Healthier Population. For the last 2 days, we have been talking about the patient. Now it's the time for the patients to speak. It's the time to focus on patients. So I would like to invite to the podium the moderator of this session, Professor Ms. Pavi, and the distinguished speakers, the Secretary General for Public Health, Ms. Kalyva, the President of the Greek Patients Association, Ms. Vasiliki-Rafaela Vakouftsi, Ms. Balaoura, Chief Executive Officer, First Health Region of Attica, and Mr. Ioannis Kotsiopoulos, General Manager of PIV, and Mr. Emmanouil Tripodianos, Chairman and CEO of PDH. I would like to welcome you in my turn to the fourth session that will focus on the transformation of healthcare for the future. Many things have already been said in the context of this conference. In this roundtable discussion, we have some excellent speakers. We have people representing different sectors: the public health system, the health services, innovation. A comment I would like to make, a very brief one, is the following. We all know that we talk about a health system that needs to be resilient. We need to maximize its effectiveness so as to get the most in terms of health for the patients, for the populations, based on the resources we have available. But we know that the more we try to make the system effective, by taking specific measures, the more the equality may be harmed. So this is a very important issue for the health of the population, especially for the vulnerable groups. We know that primary healthcare is the subsystem of the health system that improves equality and at the same time decreases the load for the hospitals, therefore increasing the overall effectiveness of the system. We also know that the public health and the public health services are the ones that define all the other indicators of the system, because we know that the health system actually is associated with a certain part of the population. So when we're talking about the public health, we need to focus on the improvement of the public health system, which is collaborating with the primary healthcare. And at the same time, we want to have a health system that is centered on the patient, that meets the expectations and the needs of the patients, and that ensures equality of access and equality, not only in terms of whether I can go to hospital, but also in terms of the quality of care provided, which actually includes technology, meaning access to technologies of equal importance, as is access to innovation. I don't want to take more of your time, so I would like to go straight to the first speaker, Ms. Fofo Kalyva, who is Secretary General for Public Health at the Ministry of Health. You have the floor, Ms. Kalyva. We are ready to hear what you have to say about the transformation of the healthcare for the benefit of the population. It is an indisputable fact that the health system is faced with serious challenges: the recent pandemic, the possibility of a future pandemic, climate crisis, natural disasters, transport challenges and threats, the aging of the population, the increased burdening because of chronic diseases, and the pressure under which the structures are, as well as the demographic problem and the societal transformations. All these create a changing environment, as is the topic of this conference, and make the transformation of public healthcare an imperative. As the moderator said, what is absolutely necessary is a redesigning of the health system so that they can be effective, sustainable, and resilient. As a solution, what we see is the combination of the public health and of health services, a system, the central aspects of which need to be transformed in order to enhance prevention and promotion of health, the universal access of citizens to health services by the utilization of digital technology and innovation, by foreseeing the predictability and crisis management, and by giving priority to health in all policies. This is something that the government knows very well. The Ministry of Health is also very aware of that. And for that reason, it implements the National Program for the Prevention of Public Health, Spiros Doxiadis, in the context of a wider planning of the RRF. So we have the national programs for the prevention of breast cancer, for γεννηματά, cervix cancer. We also have the program for exercise and healthy nutrition in order to combat the obesity of children, and the program for the obesity of adults. At the same time, we have the program for the prevention of cardiovascular risks and the program for the provision of information on the risks that alcohol involves. At the same time, we have the reform of the primary health care and its association with the public health. So the projects that are implemented are the study for the depiction of the existing state of affairs, the assessment and distribution of medtech at the health units, the upgrading of the medical equipment. We have the renovation and refurbishment of the health units and their reorganization in order for them to be united with the health system. And we have the retraining of health professionals on the basis of modern practices, development of units for the management of chronic diseases in 312 health centers and decentralized health regions, and, of course, the reform for the personal doctor. When it comes to resilience and management of crisis, in order to increase the resilience of the health system in the context of pandemics, climate change, and natural disasters, we have the reorganization of EOD, that is the National Organization of Public Health. We have upgraded the system for the identification and fight of emergencies. We have the monitoring organization. We have the development of public health at regional level in the context of the Spiros Doxiadis program. And last but not least, digital transformation in the health sector. We have several projects like the electronic health record. We have also the National Telemedicine Network, the enhancement of the monitoring of public health through the utilization of health data, the so-called health monitoring, and the health consultant who, in combination with HealthFix, is a very useful act that promotes the literacy, the digital literacy, that will allow people to be better prepared and deal with pandemics similar like the last one. So to the question, are we ready? The answer is that the Ministry of Health is ready, but there is a prerequisite that includes the wider public and the different stakeholders. What needs to be done is to understand the importance of cooperation between state and health scientists, health organizations, patients, and society, so as to ensure a healthier system and healthier population, always in the context of public health protection. And allow me to use the phrases of Angelos Sikelanos, who said that public health will eliminate disputes and conflicts and will erase from all contradictory theories that this is something transient, and will promote a spirit of cooperation in the context of which all efforts made in different sectors will always converge as sisters in order to meet the objectives and protect people.
Thank you very much, Mrs. Kalyva. You raised several interesting topics I hope we'll have time afterwards to discuss. I would like to give the floor to Mrs. Vasiliki-Rafaela Vakouftsi, who is chair of the Patients Association, the president of the Greek Patients Association, and I think that now we should hear your voice, hear your opinion. Good afternoon, and thank you very much for the invitation to be with you today. It is definitely very critical, very crucial in such a discussion to have the voice of the patients, the health service recipients in general, as is depicted over time and is represented by the Greek Patients Association, not only in Greece. We need to open up the dialogue now for a sustainable, effective and patient-centric health system that will respond to the current needs of health service recipients and will offer all those necessary services through a plexus of collaborations of the wider sectors, and all these services will need to be of high quality, because unless we have quality and safety in healthcare, then any discussion is futile. We should also talk about the role of primary healthcare and how it can contribute to enhancing the population, the health rather of the general population. Let's talk about prevention. They used to say that it's better to prevent than it is to cure, and whatever we can prevent, we should, or rather to diagnose it early if we can't catch it in the beginning, so enable to have the best possible treatment and the best possible health for the whole of population. We need to speak openly and without taboos when we're talking about hospitals that we need to redesign the health map. At the moment, the hospitals where we have them right now, there are entire areas, regions, geographical regions. There's a geographical region that does not even have a rheumatologist at a hospital, not even an endocrinologist. An entire geographical region. But we are scared of discussing the health map. It is an imperative need to redesign the health system so that it responds and it meets the needs of that population. A person living in Florida should not drive for 2 or 3 hours to see a doctor because none exist there. So we have various inequalities that may be due to cost in healthcare, or geographic, or other inequalities, because we will have to focus in the years to come and time to come how the population in Greece will have the necessary healthcare coverage. Overall, total coverage and access to the services they need at the lowest possible cost for the health system and the least hassle for the recipients. We need to discuss about something that has already been mentioned in the previous tables and has to do with patient access to innovation. We are faced with a very difficult equation. New innovative drugs, but then it will need to maintain its sustainability. Now, I'm not a fan of maths. I'm more of a theoretician, and for those who know the numbers, it's not an easy equation to actually resolve. It's not an easy thing. And in order, if we have all the stakeholders work together, we will find the golden mean and the golden ratio to come up with those solutions that will make the presence of all the stakeholders felt. And the positions of each stakeholder will be included in an overall plan and designed for the future of healthcare in Greece. And I would like to conclude with a couple of very simple things that have become the object of great progress here, but we are at a crucial crossroads where we need to take the final decisive step. As of 2022, with the recognition of the Greek Patients Association as an official interlocutor with the state on health policy matters, the map of representation of health service recipients has changed. as regard public debate and public discourse, and on how this voice echoes to whatever has to do with health. Our association is today more ready than ever to make this action now, and to have the voice of patients always there to contribute decisively to dialogue through documented proposals and positions, and to be the one who guarantee that any reform will be widely accepted by the citizens. Now, to this, the Greek Patients Association's actions as of late have been focusing very intensely in the better empowerment, training of their representatives, in order to increase the quality of patients' representations as well as literacy in the general population. You talked about that earlier. Literacy in the general population is a very important thing. It's something that will resolve quite a number of problems. It's quite something that when a patient will pick up the phone, they will not be asking and saying that I have a chronic disease, will I have to keep on taking my treatment even though I feel well? Or will have vaccinations, and people will be questioning. There will be the anti-vaxxers as a way to prevent diseases. I come from a treatment area that is immunodepressed. Now, if we go now and we ask about adult vaccination, 80% of patients, if not all, will be deficiently vaccinated, and some of them will have very pronounced misinformation regarding vaccination, although they're members of a high-risk group, and they should have been more sensible and sensitive. So how can we break this vicious circle? Well, through better information, better education, by increasing health literacy, and by participating as the Greek Patients Association and as patients' representatives to everything that has to do with health. And I want to say this: everything you discuss about health should start and end having the patient at the epicenter. Thank you very much.
Thank you very much, Ms. Vakouftsi. About the innovation-related issues, we will get to hear more by the two gentlemen. Now I would like to give the floor to Ms. Olga Balaoura, who is Director, Chief Executive Officer of the First Health Region of Attica. You already heard what the patients have to say about the organization of the health system. You have served in a hospital. Now you work in the Health Region of Attica. So how can we possibly have a healthier system for a healthier population? Thank you very much. I have the pleasure to cooperate with the Patients Association, and I hope that this cooperation will get closer in the future. I would like to tell you that in the First Health Region, we have 24 hospitals, 71 structures of primary health care, approximately 25,000 staff. And to the hospitals and to the different units on an annual basis, we have 1 million patients at the emergency care departments, 1.5 million patients coming to the outpatients offices, and every year 150,000 operations are performed. So as you can understand, the size of the First Health Region of Attica is quite significant. So in such a huge organization, there are many different issues. We have seen, and we actually see it on a daily basis, that the patients who come to our hospitals, out of these, only 20% is admitted to the hospital. The rest are ambulatory patients. They get some instructions from the doctor and they go home. What does this mean? It means that we need to approach to the primary health care in a different way and to invest in it. And we need to reform our system in that direction. So the strengthening of the primary health care for the First Health Region is a primary objective, and we're actually collaborating with the Ministry of Health in this direction. And I'm not talking only about the building infrastructure and the investments made in this, but also about the provision of health services and the way we can improve them so as to attract our patients to the primary health units, not just to reduce the burden of the hospitals, but also in order to give them the possibility to produce real clinical and scientific work. We have the clinical studies that are lagging behind in Greece in our hospitals. So in that model, The way forward is total quality management model, because this model has as a prerequisite the involvement of all stakeholders. In other words, all stakeholders need to have as a vision and as a goal the provision of quality health services. And this is true for all different stages that a patient goes through. So the adoption of such a model is responsibility of all. And what can we ensure through this model? First of all, safety. Safety for our patients, which is self-evident and what we are all after. More quality services offered on a daily basis, and of course, quality of life of the patients. Right now, hospitals of the first health region participate in European programs in the context of which we measure the quality of life of patients through the provision of more quality health services. An example is the EU On-Call that pertains to oncological patients. In a sample of 4,000 patients in 46 oncologic centers in Europe, Ioannis Hospital included, we make these measurements. So steps are made in this direction in order to measure on a daily basis the quality of life that we can improve through the health services we offer. What else can we get? Sustainability of the system. Why? Because through quality, we get the rationalization. In other words, we have improvement of the resources available of the system. We have optimal utilization of the available resources of our system. And that's not only at the economic level, and I believe that through quality you get economic rationalization, but I'm also talking about human resources and all the rest. What else do we achieve by adopting such a model of quality management? We have the standardization of processes. Standardize the processes in all the different stages of the pathway of the patient. In other words, we're talking about administrative processes, clinical protocols, nursing protocols, and their adoption. This is a very difficult model that requires effort and time. But what do we believe? We believe that through training and education, and this is the last part of the adoption of such a model, through the education of all stakeholders, we can achieve a change of culture, a change of mindset. This is exactly what we need. We all need to understand that the quality about which we're talking is not a luxury, because this is the way we perceive it up until recently. No, it is a tool that may be the only, actually, or the only way that can take us to a more effective health system. A system that will operate having the patient at the epicenter, as Ms. Vakouftsi said. And in order to conclude this short intervention, I would like to say that such a total quality management model has been implemented in Ioannis Hospital for the oncologic patients, with the certification that is currently running by Ioannis Hospital in order to be accredited as a comprehensive cancer center. And this is exactly what we do. Basically, we standardize all the processes, all the pathways of the oncologic patients so that they can enjoy more quality health services. And what do we expect to get out of these services? A better quality of life for the patients, better outcome of the disease, and, of course, a rationalization of the system. Thank you very much. Thank you, Ms. Balaoura. You touched upon the importance of education, just like Ms. Vakouftsi, so we will come back to that later. Now I would like to give the floor to Mr. Ioannis Kotsiopoulos, General Manager of PhARMA Innovation Forum. Innovation, Mr. Kotsiopoulos, and equality of access to innovation.
Right. Thank you very much, the organizing committee of the conference, for this very kind invitation to be a member of this Health World conference, wearing a different hat. And I say that I'm very happy to be sharing the same table with Ms. Pavi, that we were at the Ministry of Health, and I would like to say how great her contribution was during the pandemic and the knowledge she has to offer in the part of public health, which she also gave us here. I'm talking about Mrs. Kalyva, of course. Now, before answering your question, I would like to say that from my past experience as DG for health services in Greece, we should do things somewhat differently, in order to be able to bring innovation in the healthcare system. But to make things differently, I would like to state some things as to where we are today. I would like to say, talk about 4+1 positions as to where we are today, always in relation to the healthcare system. First of all is that the healthcare system, and you heard everyone say that it's lacking from underfunding. Now, healthcare in Greece is and should be a key priority from the Greek for the Greek government and any government. From the numbers we saw, a specific highlighting needs to be placed on public funding, because this deficit in public funding is primarily covered by out-of-pocket payments of the patients, that is, or from proceeds from the pharmaceutical industry from the mandatory paybacks. So the first pillar is funding. The second one is structural changes. If we pondered about the big structural changes we have had over the past 20 years in the Greek health system, we can see two large ones. A rather big one was the Alekos Papadopoulos reform, and then the creation of the AOP. These are the two big reforms. There were some smaller ones, but there were the key ones. So the health care system and the health system of the country suffers from a lack of structural changes that will make it walk hand in hand in the same pace with the European ones, which we are lagging far behind from, with results such as the ones we have today, many hospitals, but in many areas the hospitals being incapable of meeting the needs of the patients. The third feature or characteristic we should take into consideration for both the present and the future is the patients, that the 1 million patients who will not be the same. The case mix will be different. And the more we don't place emphasis on primary health care and prevention, the more problems we will have. It's a positive thing that there is a turn, Mrs. Kalyva, towards prevention. There is an understanding and realization that more things need to be done in primary healthcare, which you haven't seen yet. So people are there packing themselves in the emergency rooms, the ERs. And of course there is time as a factor. The more we let time go by, the more difficult things will be. And from after our past and more recent structural changes, years have passed, because we said that we would talk about new resources and new reforms. The more we don't reform our healthcare system, the equation will be more difficult, and the maths will not add up. Now, as the time goes by, technology is moving forward with rampant steps. We see huge developments in PhARMA, resulting in new innovative treatments coming faster and becoming available faster in the international environment. The question is how to give Greek patients and citizens access to those treatments. So we need to realize that this is a parallel axis. And the more we let time go by, the more difficult and increasingly difficult it will be to resolve the problem. And if we're talking about the problem of the clawbacks or the rebates or the paybacks in general, it started during the Troika years and we still haven't found a solution for that. And we as the Pharma Innovation Forum say that we want a cohesive health policy with resilience for the next 3 years at the very least, that will bring solutions to all these axes that we're talking about today, in order to be able to promote these reforms at the same time with funding, which will bring us within an environment where we will know what the predictability is. We will know what lies ahead, what lies again behind the next corner. This is what I would like to say as an introduction, and if we have more time, I have some supplemental things to say. Let's hope there's a second round of questions. Mr. Kotsiopoulos as well. That was Mr. Kotsiopoulos. Thank you very much. And now Mr. Tripodianos has the floor. He's chairman and CEO with Becton, Dickinson, Hellas. It's biotech and medtech. Please share your wisdom with us. What solutions could we expect? Thank you very much. And I would like to pick up where Mr. Kotsiopoulos left off. Clawback was a temporary measure and it's permanent. Instead of leaving PhARMA, it came to medtech as a rebate to cover some gaps in the system. So with measures such as this and with ways such as these, we can't move forward. We're moving backwards. I heard Mrs. Vakouftsi very carefully, and we had a discussion earlier outside. And she placed the problems where they are, which is where we start. We need to see the actual needs, to see patients and healthcare professionals what they need, and doctors in general, and to say about the here and now. We're designing reforms, governments change, governors change, everyone changes, and then we're back to square one. We need to decide and to agree on a minimum level of reforms and keep it, regardless of who will be head of the company today, who will be SG, like Mr. Kotsiopoulos, and so on and so forth. We will have to start with the collaboration and the participation of everyone in a design, in a planning. I'm very happy to see Mrs. Balaoura here, because I met with her, and she was the governor of Agios Hospital, and they did excellent work in the implementation of innovative methods. And other hospitals, like the one in Heraklion. But unfortunately, they are the exceptions. We need to move out of the exceptions and create a rule. And these examples become a beacon of light for everyone to follow. So can we do this change? Yes, of course we can. So there are problems. It's the aging population. It's the inequalities in Greece in how health services are offered. It's a different way in which it is offered in the islands, where we have a huge scattering, and it's different in the centres. There's a difference in the quality of health. 1 in 20 patients that will be hospitalized in Europe, they will suffer an infection. Hospital infection. 20% of those infections are due to an OR. It's surgery related. So this cost is 9,000 to 17,000 euros. So you realize, unless we deal with these problems, it is futile to do anything. It's like a black hole where you're shoveling money into. So we need to find a way to save money and to remove rebate. Rebate is a small amount on the cost of materials. We know the cost of materials, what it is. It's a very small fraction of the turnover of a hospital. It's under 20%. The big cost lies in the other things that need to be dealt with. Yes, there are problems, and the thing is, what we as an industry can do all together to deal with these problems, to offer better solutions. The industry can help the HCP offer better solutions, offer better services for the patient and better services for themselves. They're working in a very difficult environment. They're working endless hours under awful conditions. So they need to be in a better state to be able to deal with the problems better. We offer education as a sector, and the paradox is, the conundrum, and we'd like to look at this with you, Mrs. Kalyva, is that the industry is forbidden from offering services of education in our centers of excellence to healthcare professionals or hospitals. And you see, innovation comes from the industry. It's the industry that creates innovations. Who is more appropriate to train a doctor? I can't take a Greek hospital doctor and take them to Spain, Germany, or wherever. It's forbidden. And this is the paradox in the system. There is artificial intelligence that is coming, and it gives a lot of solutions, like tailor-made medicine. We have telemedicine. Having patients not have to undergo the stress of moving and have their problems solved. We have digitization. Without digitization, so digitization has actual data from the hospitals that allow us to plan forward. In the previous panel, they talked about value-based. Value-based is just looking at the current situation, the status quo, what the problems are, measurable, agreed upon, and move forward. Unless we have these data, we can't be talking about these things. And like Mr. Apostolos said yesterday, we're moving forward with a patient's record, and unless we have that, we can't do value-based. Now, we can't wait until the data be ready. We need to have an intermediate solution. Like Mrs. Vakouftsi said, time is of the essence. It's the key, crucial point. We need to agree on some solutions now and on some targets to meet those, to resolve those problems. I had prepared a video, an example with a new technology that helps from telemedicine, but I think we've all seen such examples, so it's pointless. It's a moot point for me to show this, and we've got a lot of examples, all of us. What I wanted to say is that we must all act now, because we all have a maybe inside of us. So there is a technology that maybe could have helped him, and it wasn't available there, it was available at another hospital. It was an elderly patient. Maybe that solution couldn't help, and the solution was my company, that we didn't manage to reach that hospital. So that maybe is always in the minds, and the what-ifs, the maybes. We shouldn't have the what-ifs in the future.
I believe we have some time for another round of questions and answers. And I would like to start with Ms. Kalyva. Of course, I come from the sector of public health, so I cannot help myself but ask the following. We know that public health is a field that is the responsibility of the public sector. But in Greece, we have a health system that has a quite extensive private sector. So in the scientific term of public health, do you see any role of private sector in the public health? Public health pertains to the population and to the various different smaller or bigger groups. It is associated with populations. That is why it is called public health. The Ministry of Health regulates both the public and the private sector. So it goes without saying that we refer to both sectors, and we actually have the cooperation between the two sectors for the implementation of the programs. For example, for the IMATA programs, what we try to do is to ensure the participation of all units that have the capability to conduct this check, but also at the primary level and generally wherever the private sector can provide us with the opportunity to collaborate and to work together, we promote this cooperation. This is true for all programs, and it is also true when it comes to the cooperation at the ecologic level. We will see the development of the ecologic hospital in Salonika. Of course, this is true for all sectors. And the pharmaceutical companies, I believe it is self-evident. We do not make any distinction between public and private. We are talking about populations when we talk about public health. Okay, thank you very much for this answer. Before, I have to confess, and I usually say that in my teachings, many times I feel that when we talk about the national health system, when we talk about the health system, we all tend to think of the national health system, whereas we have a mixed health system, which means that sometimes we tend to forget that the private sector is involved. So we need to have this in mind, that it is a private health system if we want to enhance it and strengthen it. Thank you very much, and maybe we will have some time later. And now I would like to ask Ms. Vakouftsi, first of all, are you satisfied with the institutional participation of the patients and with regard to the education that you mentioned? You gave us examples about the vaccination and illiteracy, based on the research, what we know is that what is of great importance is whether people feel trust to the organization that conveys the messages and that provides education. I would like your answer with regard to this too. We're talking about education, but I also believe that we need this education to be provided by a trustworthy organization if we want to convince the population. And moreover, how satisfied are you by the institutional participation of patients? First of all, it is a huge leap, the fact that the voice of the patients has been institutionally recognized. If we were in this same room 4 years ago, this would seem like a science fiction. The previous and the current leadership of the Ministry of Health, the cooperation that we have is very good. And indeed, we have had a very good communication with the ministry. The ministry is always open to hear what the patients have to say. Are there more steps to make? Of course, but just keep in mind that only 2 years have gone by since the institutional recognition of patients. Now, the representative of the Hellenic Patients Association can take part in board of directors of organizations, which is something very beneficial and will allow us to get some best practices from abroad. The level of the association is as it is today. It has the possibility to make good proposals. It has this good cooperation with the leadership of the Ministry of Health, so we are optimistic about the future. With regard to education, it is very important where this education comes from. And I believe that most of you have already observed that after the pandemic, even organizations that had a good reputation actually lost part of this good reputation and therefore part of the penetration they had in the population. For example, if some information was coming from the state, which is a highly trustworthy agent for the provision of information, it didn't get the response it expected because certain parts of the population were easily manipulated or were using this information and wrongly translated into a theory of a conspiracy. And all this created a bad reputation and a bad reception of information. So I believe that in the future, we need to focus on restoring the reputation of the organizations providing information and education. And we need to work all together in order to achieve that. Because if information has the seal of more than one organization, this will be better for all, because more people will trust it. Okay, but here in Greece, we have an issue of trust. I believe that this is a conclusion that we can draw from all research, and I mean trust to the state. This was evident during the pandemic, actually. And allow me to say that the health professions played a role that was not always positive. In other words, I would expect the health professions to play a more positive role during the pandemic. Thank you very much. Ms. Balaoura.
Right, you spoke about placing emphasis on primary health care. We know that in Greece we have a bit of a problem regarding the continuation of healthcare, the interconnection between primary healthcare and hospitals, and another issue. We heard Mrs. Vakouftsi say that we need to have equity and equality in the distribution of all hospital units so that all areas can have. But can we have hospitals on each island and MRIs in each village? This goes against the design we need in the efficiency, and it has to do with the culture of this very population. I mean, I don't know what you would say here. Okay, well, geographically, it's outside the district or the region, as it were, but I'm just joking. Now, before starting and responding to your question, I would like to make a clarification. I don't know why it's not clear in Greece here. When we're talking about national health system, we're talking about the public and the private sectors together. It's a single system. If we want to talk about a reform separately, yes, we're talking about the public health system that pertains only to the public healthcare providers. When we're talking about the national health system, it includes the private and the public sector. It needs to be clear and to demystify all this, because it's something like we can't touch the private sector. It's something different, and we need to expel this. This is something that I can answer here. And primary healthcare, as of late, is in a very adverse position. It's very bad in terms of resources and in terms of building infrastructure. And I don't think that the gravitas that should have been attributed has, thereby including it in the design of the national health system, including the private sectors as well, so as it should, in order to meet its role. Not just the gatekeeping, I mean, to keep the patients outside the hospitals, but to play a role in prevention as well. Primary healthcare plays a great role in prevention. We can't do prevention at hospitals. Unfortunately, what we are doing is exactly that, but we shouldn't. So the upgrade about which we're talking and has to do with primary healthcare should have these two pillars. As to the interconnection, this is a different thing. How to interconnect primary healthcare with the secondary one and the tertiary, of course, and there we need a very good design. And we need what I saw in my first my first speech where we have the optimal use of our resources. Mrs. Vakouftsi talked about the health map. You know, health map, apart from the geographical region, is the redistribution of the resources, the infrastructures, human resources in your district, in your region, locally. So we need to do a lot of serious work to see which needs we'll need to cover in our area, in our region. We saw that in the first health district, the disease that is running first is CVDs, cardiovascular diseases. So we should possibly stress that, or pay attention more to that. And we need to take into advisement what Mr. Kotsiopoulos said, that we have an aging population, which brings us back to prevention. So our structures will need to be staffed in a way to ensure that we can meet the needs of our patients, whatever they may be, depending on the characteristics we have locally. Surely we can't have doctors of all specialties in all areas, but what we can do is for key specialties that can cover both prevention and the provision of primary healthcare, to have such a design and a planning that ensures just that. Thank you very much. Now, we don't have much time, so I want to ask a very, very quick question to Mr. Kotsiopoulos. Could you give us, in a nutshell, an example of the PhARMA sector from abroad that could be applied fairly quickly in Greece and bring some quick solution regarding access to innovation? Now, a general remark and picking up where I left off. I think that we all know what we need to do. We know what reforms we need to make, and what really must be done is to make things happen faster. I can see Nikos Polizos. We started some 10 years ago with the DRGs, and we need to come today to see their full implementation. I heard what Mr. Messaropoulos had to say, and the Greek hospitals still don't have DRGs, so the transformation of the Greek system is there. It should create the fiscal space for innovation in drugs, and they need to be made fast, with a lot of speed. And the pharma industry brings here solutions. Okay, so I will take I would like to say that Mrs. Balaoura, the Ministry of Health, implemented the Ecothen program at home. Cancer patients, instead of receiving the chemotherapies at hospitals, they were released and they can have their treatments at home. How does the drug play a role? It does because innovation in the drugs allows for this sort of at-home hospitalization to occur with fewer consequences for the patient. The drugs are much more harmless. So we have a combination of innovative treatment solution, technology in which we can monitor patients at home, and transformation of the national health system. Instead of packing people in cots in hospital corridors, they can receive healthcare services at home. We have a win-win situation for everyone. This is how I imagine the future and the national health system. One in which we can utilize innovation to do things differently, but at great speed, because we're lacking time. We don't have time. And I think that our proposals as the PhARMA Innovation Forum bring this perspective, that we need to do things differently and very, very fast. Right, great, thank you. And one last fast question from Mr. Tripodianos. You said that the cost of materials is low, but we know that the more that technology runs forward, newer technologies have a higher cost. Here we have an issue with what is the mechanism behind the procurements, because these mechanisms have to do with the quality of the device which is being procured. Well, they shouldn't they? Yes, this is just the comment I want. Well, the pressure of time, the deadlines, and the pressure of the EU to finish tenders within 8 months do not allow for the Central Procurement Authority to implement quality criteria, and the only criterion is the price. So we miss the advantage and the opportunity to put value in it. And time, that Mr. Kotsiopoulos said, technology is rampant. And the cycle of a tender from the specification to the completion can be up to 2 years. It's definitely over a year. Until its completion, you realize that the technology is outdated and we're purchasing something that is already antiquated. And in the other countries that are running things faster, they have a more modern material and product. I said that it's low compared to the other costs. So if we base ourselves into limiting the cost of the device and the drug, and we miss the value, technology and everything, then we're paying other costs. Which is why I mentioned the cost, 9,000 to 17,000 euros for an infection, that they will need to receive drugs. These drugs are added to that clawback and everything, so it's up to the companies to pay the slab. Again, it's a tremendous cost. Now, okay, regarding procurements, it's a process that you too see that needs to be included in the transformations. Yes, this is where we must start everything. Now, we don't have any more time, so I should like to thank you very much for your participation, for the great things you said. I hope you found all this discussion very interesting, and I should like to thank you very much for participating.